Under-eye bags are one of the most common questions in eye care, affecting many people. Almost everyone has looked in the mirror one morning and thought, why do I suddenly have these puffy bags under my eyes, and how do I make them go away? Today, we're going to separate fact from fiction and give you the real, evidence-based answers. We'll explore what actually causes under-eye bags, natural ways to reduce them, and why most miracle under-eye creams are not recommended. Finally, we'll discuss the only permanent solution that truly works. Let's start with the science. The skin around your eyes is the thinnest in the entire body, only about 0.5 millimeters thick. Right beneath it lies a thin membrane called the orbital septum. When we're young, this septum is firm and keeps the orbital fat, which cushions the eyeball, pushed back in its place. However, with age, sun exposure, and genetics, two key things happen. First, the orbital septum stretches and weakens, and second, the skin loses collagen and elasticity. As a result, the fat pads start to bulge forward, creating the characteristic bag or puffiness under the eyes. This condition is called lower eyelid fat prolapse, and it is the #1 structural cause of permanent under-eye bags in adults over 35 to 40. Dark circles are different, mostly vascular or pigment-related, but bags are almost always protruding fat, sometimes with fluid. Even if you have structural fat prolapse, certain lifestyle factors can double or triple the appearance overnight. High salt intake leads to fluid retention in the thin under-eye tissues, similar to why eyes are puffy after crying. Allergies cause histamine release, which leads to swelling and dilated blood vessels. Dehydration and alcohol impair lymphatic drainage, while sleeping flat on your stomach or face allows gravity to pool fluid under the eyes. Fortunately, there are quick fixes that actually work. Sleep with your head slightly elevated using an extra pillow or wedge. Reduce salt in your evening meal to prevent fluid retention. Apply cold compresses or chilled gel masks for 10 to 15 minutes in the morning. This vasoconstriction reduces swelling fast. Gentle lymphatic massage, sweeping from the inner corner of the eye outward 10 to 20 times with clean fingers, can also help. Eye allergies are a massive trigger for under-eye bags. Histamine makes blood vessels leaky, causing fluid to leak into the tissue, resulting in puffy, itchy lower lids. The best evidence-based protocol starts with cool compresses. Follow this with mast cell stabilizer or antihistamine eye drops, such as ketotifen or olopatadine, which are often available over the counter. Oral second-generation antihistamines like loratadine or cetirizine can be used if needed, but be aware they can dry the eyes. Crucially, never rub your eyes, as it releases more histamine and makes everything worse. There are literally thousands of creams promising to erase bags, but here's the truth from the medical literature. Temporary tightening serums with caffeine, albumin, or certain peptides can offer a mild, short-lived tightening effect for a few hours, useful before photos, but not a real solution. Most creams contain preservatives, fragrances, or retinoids that are not adequately tested for the delicate eyelid skin. Peer-reviewed studies have shown that long-term use of many preservatives and retinoids around the eyes can permanently damage the meibomian oil glands in the eyelids. This damage can lead to chronic dry eye, blepharitis, and paradoxically, even worse-looking under-eye skin. Bottom line, eye doctors almost never recommend regular use of cosmetic bag creams. If you want safe hydration around the eyes, look for fragrance-free, ophthalmologist-tested products specifically labeled safe for eyelid skin. Once the orbital septum has permanently stretched, no cream, laser, or home remedy can put the fat back where it was. The gold standard, long-term fix is a surgical procedure called lower eyelid blepharoplasty, sometimes called a lower lid lift. A tiny incision is made either just inside the lower lid, which is transconjunctival with no visible scar, or just below the lash line. Excess protruding fat is gently removed or repositioned, and if needed, a small strip of loose skin is trimmed. The incision is then closed with fine sutures or left to heal invisibly. Recovery typically involves 7 to 14 days of bruising and swelling, with natural-looking results that last 10 to 20 years or more. The complication rate in experienced hands is very low, less than 2%. This procedure is performed by oculoplastic surgeons or facial plastic surgeons with eyelid specialization. While you can't stop aging, you can dramatically slow down the process of under-eye bag formation. Daily broad-spectrum sunscreen on the eyelids, mineral-based if possible, is crucial. Wear UV protective sunglasses with large frames or a wraparound style and wide-brim hats outdoors. Retinoids should only be used if prescribed and monitored, and never self-apply strong retinol directly on eyelids. Maintain a healthy sleep position, slightly elevated, on your back or side. Consistent hydration and moderate salt intake are also beneficial. To summarize your action plan, start tonight by sleeping elevated and using a cold compress in the morning. Cut evening salt and manage allergies aggressively. Skip the random under-eye bag creams and protect your meibomian glands instead. If bags are structural and bother you long-term, consult an oculoplastic surgeon for lower blepharoplasty. It's the only true permanent fix. Prevent worsening with daily UV protection and gentle eye area care. Under-eye bags are extremely common and completely normal with age, but now you know exactly what works, what's temporary, and what's marketing hype. Take care of those beautiful eyes. They have to last you a lifetime.